All right, so here's the part two of chapter 16. So I was just referencing in part one that there's a lot of research around the benefits of therapy, medication, or psychopharmacology, and or the benefits of combining them. So again, as I was referencing, studies have been done on the providing uh, uh, um, studies on the benefits of a particular medication, for example, maybe one that's coming on the market or hasn't yet entered the market to be prescribed to people. Um, there's a push, it's been a push for many years for therapies to become more standardized so that more people are, regardless of really who they're seeking therapy from, as long as they have similar training, like say in cognitive behavioral therapy, that there's actually a much more standardized content and approaches to the treatment, etc. So a lot of research has been done. Very quickly, um, there is there is has studies have been done that do show that people who are receiving, for example, medication, psychopharmacology, um, actually remain in the community for longer periods. They therefore avoid hospitalization. Um, Also, a combination of medication and psychotherapy have been shown to be very beneficial for people who are living with both schizophrenia and bipolar depression. I'm going to tell you one of the reasons why I think it's very helpful in general to combine medication and psychotherapy, for example, is, say, with anxiety disorders. So some of the anxiety disorders are one of the causes for them, as we discussed in chapter 6, is the thoughts, the beliefs that people have. They're what we call cognitive distortions. I'm talking now from a cognitive behavioral perspective. And how do those cognitive distortions affect, or false beliefs, how do they affect the person's behavior? And the result is, of course, if the thoughts are not really addressed, if the person doesn't see that sometimes they tend to catastrophize, or with events that are happening around them, or they personalize a lot of things that are happening around them. If you don't address those core beliefs, those more irrational beliefs, then they're not going to get better because their thought processes are not changing. However, introducing cognitive behavioral therapy, for example, can help the person to, it will, over time, the symptoms of anxiety can be reduced. But sometimes the therapy is not enough, and sometimes a medication can be helpful. For depression, for example, the same thing. People can learn skills. They can learn different ways of managing the therapy, but sometimes the therapy itself is not enough, and sometimes a medication like an SSRI, selective serotonin reuptake inhibitor, may be what's beneficial for folks. That's something that I was prescribed, and I'm currently prescribed, and I have found that that has been beneficial for me. I also have a history of depression in my family. So I've learned over the years that as much support and the resources and just, of course, some of the training that I have is great, and it's been very helpful for me in the course of my life. But there are some times that it's just not, even that's not enough. So I am one of the people that sees benefits in both from psychopharmacology and also medication, I should say, and therapy. So again, there are benefits. There are also clearly downsides, but I think in general, the research has suggested that for many of the illnesses that people struggle with in terms of mental health, for many, a combination of therapy and medication could be beneficial. Not in all cases. Um, I will also say just a very quick thing. Psychotherapy is something that a lot of people are really interested in it. There's a lot of different therapeutic approaches. So Again, I'm just going to go into those just a little briefly here. Behavior therapy, if you think about behavior modification, you can use behavior modification yourself if there's a goal that you have. For example, maybe exercise more or lose weight. You can apply methods of behavioral therapy to change your behavior. Behavior modification, behavior therapy is used in elementary school settings, for example, and giving children token economies for maybe being quieter in class or any another behavior. Maybe they are getting up and running around the room a lot, and they can use a reward system that the child recognizes as being important to them, and they can earn rewards, and they earn rewards by changing their behavior. So a lot of different things to really understand about behavior therapy, but really interesting stuff. As you can see here, there are different examples of it. I mentioned token economies. Aversion therapy, exposure therapy. These are really interesting types of therapy. Exposure therapy, for example, and the textbook talked about it. If you have a fear of spiders, well, you're going to avoid them, because that's what people do who have a fear of spiders. Rather than feel the anxiety, the tension, the discomfort when you even think about a spider or look at them or see one, you'll just avoid them at all costs. And in exposure therapy, they'll actually over time get you to first, for example, maybe look at a picture of a spider, and then over time you'll have an opportunity to actually see a live spider and begin to interact with it, and the therapist can help you to address your fears and your emotional distress, your discomfort, teach you skills on how to manage that, so that over time you see that the fear of the spider is actually irrational, and that you can now live with it and can kind of move on with your life and not have that in your way anymore. So many different types of behavior therapy, but again, very interesting, and I encourage you to look at some of these. I'll just say quickly, behavior therapy can sometimes be relatively brief. It does not have to be, people don't have to be pursuing long-term therapy with this approach, and there are some very specific symptoms, like I just talked about, a specific phobia that it can address, very commonly used with anxiety disorders, for example. As I said, it's one of the newer approaches to mental health counseling, but nonetheless is showing benefit for people overall. Cognitive behavioral therapy, this is more my background, more my training comes from here. And as I was saying earlier, that it's really a matter of, I think, in this therapeutic approach, is really understanding how there's a connection between your cognitive processes, your emotions, your motivations, and then finally behavior. So there's a connection between your thoughts, your emotions, even physically how you feel, and then the resulting behavior. So the thought is that if you can address what might be some irrational or inaccurate thoughts, for example, those can then potentially change your behavior later. And it can also change how you view events that are happening around you, and that can then lead to change. There's a lot of different people out there that have done research in terms of cognitive behavioral therapy. Ellis is one of the big ones, but also, as I said, mainly it's getting at maladaptive or really ineffective thought processes, and really getting at how they influence behavior, and then ultimately how can you help the person to change their behavior. This also has benefit toward decreasing symptoms of depression and anxiety. Beck was another researcher. So again, just talking in terms of cognitive behavioral therapy. It's really well documented. There's been a lot of research that's been done around it. Also has been shown to have benefit for people with, for example, eating disorders as well. We talked about that in Chapter 9. I'll skip this, but to an extent, we'll say the active ingredient, if you will, in cognitive behavioral therapy is really understanding, for the person to really understand the connection between their thoughts, their emotions, and behavior. Humanistic or experiential therapy is very, very interesting stuff. One that might be more familiar to you, you may have heard more about, is motivational interviewing. That comes directly from the humanistic approach, like Carl Rogers, for example, or Abraham Maslow. Those are some of the more famous, if you will, humanistic or experiential theorists. But very interesting stuff. So again, this approach in therapy is very client-centered. It is very different than, for example, psychoanalysis, which we're going to talk about in about a minute or so. So again, this has its benefits. It's really, this is where I said before that people that seek therapy sometimes are seeking it for more personal growth. And there's a lot of the self-support movement, self-help movement has really grown from the humanistic experiential therapies. So this, again, is really important for you to think about if that's something that you want to learn more about. It is, as I said, it has definitely had a lot of influence as well on therapy, and it does overall have some good outcomes. I said I would talk about psychoanalysis, so it's one of the psychodynamic therapies. It's one of the oldest types of therapy that are out there. Some of the classic features of psychoanalysis, are free association, analysis of dreams. That's probably some things that you remember from chapter 3, or from maybe a prior course, if you feel like a Psych 101. Again, a much, much older therapeutic approach. Lots of research done around this, and it does influence therapy today. You'll hear people talk, for example, about in therapy, therapists in transference and countertransference. So those are very real things that can happen, and that this research, the basis of transference and countertransference in a therapeutic relationship, the roots of that come from the psychodynamic approach. It is a very, very interpersonal therapy, and that's a part of some of the benefits of it. Some of the research that's been done around attachment theory between children and their parents, for example, results from the psychodynamic therapies. So that's more the contemporary or more modern, if you will, approaches. So very interesting stuff if you're interested in looking at how do you understand attachment theory between a child and a parent or caregiver. So its roots are right here. Marital therapy is very straightforward. It is what it sounds like. And it's really teaching people to recognize their behaviors and to move toward conflict resolution, sometimes through helping to improve communication and problem-solving skills. It can be short-term. There's a family systems approach. It's actually something that I have had a lot of interest in and have a little more experience with too. The family dynamics are extremely interesting, but are extremely important in really understanding some of the issues that families struggle with from time to time. And again, here also understanding how behaviors are influenced in different ways by different family members and for different reasons, and also helping the family to resolve or improve their communication as well. So very, very interesting stuff. You have to, one of the key theorists is named Minuchin, and he did a ton of research early on, and this family systems therapeutic approach has really emerged from that, but very, very interesting. Minuchin. And then, of course, couples therapy. It is self-explanatory, but again, it's using, and there are some more traditional approaches to it, but it has, and you should be trained in doing couples therapy, just like you should be trained to do family therapy. The approaches do differ between couples therapy and family therapy, for example, but nonetheless can be beneficial for folks. I will just say quickly here that some therapists, for example, will sometimes combine or will pull from different theoretical perspectives in the therapy that they provide. That can sometimes be beneficial. But again, the core, most important part is that the therapists have at least one theoretical model or approach that they work from, and then if they pull in elements of other types of techniques, for example, that could be beneficial. But they really have to have mastery over at least one therapeutic approach. That's why I say, for example, my foundation and the work that I do is really based in cognitive behavioral therapy, but there may be elements that I will sometimes use from other perspectives as well. Just very quickly, this is just for thoughts to consider. There's obviously critique, as well as different perspectives that are out there in the communities, and these are things to think about. Does therapy itself, is that really a part of, say, the medical model, where people are viewed as being sick and that they need to be cured? Are therapists really helping to maintain, like, quote, the norms of society? Are they themselves, are they agents of change? And what are they doing to help in society, and either maintaining things as they are, which could sometimes be in the long run harmful for people, or are they helping people to make sense and to be able to function in what could be, for all intents and purposes, a kind of a crazy world? So things to think about. Anyway, I hope this was helpful. This was, as I said, chapter 16, and I will not be testing you on chapter 16 itself. However, there could be elements of this chapter that could be beneficial to your research paper. And we did talk about some types of treatment in other chapters already. And we will talk about different types of treatment when we get into the next, when we get into chapter 13, if I recall. So more to follow. A couple more things. Bear with me just a moment. I'm going to actually skip this one. I thought I had taken the slide out. I'm sorry. There we go. One more thing to think about is for therapy, the question is the therapy effective for people who may be from more culturally diverse backgrounds? And also, how is therapy helping in addressing the needs that people have, or how is the mental health system itself addressing the needs of people who may be underrepresented or underserved? In other words, what can we do to extend, how do we get mental health treatment out to people from a wider range of socioeconomic backgrounds, cultural backgrounds, etc.? There's a lot of people out there that are not getting the help that they need. That's really what it boils down to. And then finally, how do we ensure that the people that are getting trained to do therapy are from more diverse backgrounds and are therefore a better reflection of who they're actually there to serve? In other words, if you want to see a more diverse client population, right? Racial, ethnic diversity, cultural diversity, etc., socioeconomic background, class. What do you do to ensure that there are people that really are more representative of that diversity in the therapy pool itself? So you can't, my point is, you can't have, if you want to bring and ensure that you're delivering therapy to more marginalized communities, it's not beneficial, in my view, to have, for example, white males as the only people that are providing the therapy. So I think that should make sense. Okay, I'll wrap that up here. The deck itself will be in Canvas. I'll just say there are maybe a couple of things that I didn't get to. I may do another video at some point which will talk more about, actually, you know what I'll do in chapter 13, I will talk more about some types of treatment that have been used in the past to treat schizophrenia, and that's where we'll talk about, we'll wait until we get there. There are some types of treatment, both past and present, that we'll talk about in chapter 13. So anyway, we'll get there. I hope you found this helpful.